Tom?
Let's see total motion release being done on a patient with hip replacement 2 months ago, right around Halloween time. And it's which side?
The left side.
A year ago, hip replacement on the right side. So she is, what, about 8 weeks, 9 weeks out from surgery. So I'd like you to see some of her motion. So I just want her to get up and walk around. So go ahead and, so you'll notice the way she, and why don't you just walk that way and then walk back. So you'll notice it, and then come this way. And so you get that little get up she's got. All right, come on back over here. And that's kind of the speed she's got to. Hold on, don't stand. And will you just show us how much you can bend over? Let's see her bend one more time. And again, a lot of you guys will say, ooh, there's hip precautions of bending. And come on back up. And I always ask, you know, I don't try to break any protocols. And I ask, how's it feel? And she says it kind of hurts her back somewhat. All right, no big deal. And we'll just see, you know, whether she feels like, wow, that feels so much better next time. It doesn't mean that we're going to, you know, go down and touch the floor or anything until it feels like, wow, I could do that if I wanted. Because remember, when you cut yourself or you get cut with surgery, well, if I cut your hand, you know when you're ready to come back up. All right, so your body's not going to let you. And so I don't go and say, oh, let's force that down. I just very gently say just how that feels. And when they treat themselves, all of a sudden they say, wow, that's a lot better. Now, maybe they don't want to go further yet, just, you know, from protocol standpoint, that's fine. But from here to there may just be like, wow, that's so much freer. And then they'll say, oh, I don't mind doing that now. All right, so let's take her and sit her down. And I just want to have this run. All right, so I'm not going to break anything. I want you to have the raw footage. And what am I going to do with her? Well, I'm just going to take her through and test her arm raise, trunk twist, leg raise, and a sit to stand from a very high surface. Now, you guys, again, will run into certain protocols, and I will show you when it's appropriate and when it's not, or when I should say, you'll see when things are inappropriate when you're not. So you'll be able to observe them rather than, you know, have to have this sheet of what's appropriate and not. You'll actually see the reaction on the patients. So what I'd like you to do is, and she knows the exercises, degree, so I would like you to go ahead and do the arm raise for me. And she'll keep it right up, keep the elbows straight, good. Now put that back down. And I'm not going to use a form on this one. Let's just have this be a patient, and I'm going to ask her, good. And which one of those is worse?
This one is worse, the left one.
Left one, okay, good. Put your hands on your belly. And slide up to the front of the chair. Put your hands on your belly and twist around as far as you feel comfortable. All right, because again, twisting becomes a thing. Just feel what that feels like. And now the other one. Which one's tighter?
They're both about the same, but when I twist this way, it pulls here.
Okay. Now your most recent operated on hip is which one?
The left.
Okay, fair enough. And so when you rotate, which way does it bug your left hip? Try it again. Go ahead and do it again. And now do the other one.
Kind of pulls.
Pulls it.
Yeah.
Touch where it pulls. Okay, good.
It pulls right there.
So just feel, remember what that feels like. And now what I'd like you to do is stand up for me. Good. And we're going to turn the chair. Go ahead and, no, it's not quite right behind you, so go ahead and step back and sit down. So just take a look at her body. Put your side to the front of the chair, or this front of the chair now. Put your leg out. No, put it out on the ground. And that makes it straight. And now lift it, and you're allowed to lean back some. All right, that's good. Good. And now put it down. Do the other one.
No.
Interesting. So that's your last year's operated on leg.
Right.
This one's the fresh one.
Right.
Fresh one feels stronger than your what you would think would be a good one, doesn't it?
Right.
Okay? Just to let you guys know that stuff. They may say, wait a second, that shouldn't be right. It is what it is. Now, I'm going to ask you to do a sit to stand, but not from there. We're going to raise up the height of this and just see, and keep the camera rolling. Keep the camera rolling. I want this to be a live time. I want you guys to see how long this is really taking without any video editing. Now, this may be still not high enough, and I've got 2 more chairs, and it's probably not. Do you think? But just because she just had what she had going on, I've got a little higher here. We can come back down afterwards. But again, I'm still going to try to make her do this on one leg. And now if she says, hey, I feel like I'd like to have a handhold on something, that's fine. Do you want to have a handhold a little bit? Or see what?
I'll try it first without it.
All right, so pick up a leg. And no problem, if they had a walker or something, I'd let them hold on. So go ahead and pick up one leg and try to get up.
Up?
Yeah, just get it off the ground and get up. Very good. And now try the other leg. Okay, so, all right. So she had to use some handhold. Sit back down. Okay, so I always find it fascinating. More to go. All right, so which one of those exercises, and you guys should know right now, which one of those exercises look the most different left side versus right side, which is the second, which is the third, and which is the fourth. All right, let's see what she says and see whether we get around the same exercises. So the sit to stand, the leg raise, the twist, or the arm raise had the most left to right difference.
Let's see. The sit to stand, definitely.
Okay, so that'll be ranked number 1 for her. Do you remember the other 3?
And I think probably the twist.
Was number 2.
And the arm.
What about the leg raise?
Bad.
What about this one?
Yes, the leg raise definitely on the right side.
Would be number 2 or number 1?
I would say number 2.
And then number 3 was twist or arm raise?
And the arm raise is better.
The best.
Right.
Okay, so you would think, hey, let's start with a sit to stand, and we could start there. Or I can say, hey, I wonder what would happen if we treated the arm out because it was her best one. Now, why would I do that? It depends on where you are on your lessons right this second. All right, so if you've gone through this a bunch, you may say, oh, okay, he's just trying somewhere else. If you're early on, you're saying, wait a second, you told me to start with number 1, not number 4. Which one would be more fascinating if she got better for you to see? Would you like to see her get better with her hip doing a lower body exercise, or would you like to see her get better with her hip doing an arm exercise? I kind of like to, fascinate people as far as that goes. And it's a better one too. So it doesn't matter. I'm going to be crazy, and I'm going to have her do the arm raise first and see what it does to her. Fair enough? So we'll test her. We'll test her walking. We'll test her bending, and we'll even test her sit to stand after she does the arm. So go ahead and do your arm raise one more time. And now the other side. And which one's tighter?
The left side.
Left side. So, again, she knows how to do this. So go ahead and lift up. Now up, 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 back, 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 back. 2 sets of 20 seconds. So up, 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 back, 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 back. Up, 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 back, 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 back. Don't turn too much right now. All right, just stay there and do it again. Okay. Nothing's wrong with a little bit of turning, but I'm just trying to keep it pure right now. Up, 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 back, 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 up, 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 back, back, back. Keep on going. 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax. Retest what that feels like. Pretty good? Feel pretty good?
Yeah.
You see how much further back it went?
Pull.
It doesn't pull. Now, what would you like her to test first now? Let's just make her do the sit to stand. Well, why would we do that? Because that was a pretty neat issue. So can you stand up on your left leg for me? No, sit back down. Pick up the right leg. Now get up. Look at that. Yes. Okay, she had to use the chair last time. Stop. Now, will you stand up for me? And just bend over to where it's comfortable and see what you got going. Here you go, girl. All right, come on back up. Notice the speed. That's what tells you she's better. And now why don't you go do a little parade there of walking. See whether she's got that little gitch. Now, come back towards me more because the camera's hard to see. So stay over here and walk, okay? And just walk that way. And then walk back. So she's still somewhat slow. And you can walk faster if you can. Not bad, right? From an arm raise. This is real life stuff here. Come on and sit. What should she do? Rule number 1 says, if it's working, do it again. Ready?
You want me to do the arm again?
The good side. Yep. Come on. Up, 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 back, 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 up, 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 back, 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 up, 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 back, 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 back. 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Not yet. 2 sets. Up, 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 back, 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 up, 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 back, 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 back. Now, which one is she? You keep going, you count 20. Which one is she more likely to do during the day? You know, a whole bunch of arm raises that help her, or maybe a whole bunch of sit to stands? Well, it depends. But a lot of times it's easier, and when I say, you know, it's easier to get these kind of exercises in than finding a place always to do a sit to stand necessarily. Retest this. Good. Get up with your sit to stand, see what it feels like.
My left?
Pick up, yep. Oh. Excellent. And I want you to come down though. Pick up that right leg and come down too. Excellent. All right, get up and walk, or get up and bend over for me. Excellent. Come on back up. So a lot of times people don't move or bend further forward when they can because they don't know what the doctor says don't bend. Don't bend how far? Or don't bend at all. And you know, in order to heal, you have to be able to go through motions. And so a lot of people stay in a stuck position and it's not allowing them to heal. So go ahead and walk for us. Now she's got a lot less gitch. It just seems like a more stride, bigger, longer stride. And come on and sit back down.
The only thing, it pulls a little right there. That's it.
Pulls a little bit right there. Now we can go to the next one. If you wanted to go to number 3, that's fine. All right, and let's do it. Let's work in reverse order. Why would you do that? Well, just kind of fascinating to see something improve like that. So will you stand up for me though? We'll keep to the system. Go ahead and sit down.
Usually I can't sit up or stand up that well.
Will you stand up one more time? She just said that normally she can't even stand up that well. And so remember, we check twist down here. So will you go ahead and sit down to lower chair? And just now get up again, because she just mentioned usually I don't get up that well. So that's pretty decent. Sit back down. Stay to the front of the chair. So you guys, I'm working in reverse. 4, 3, 2, 1. Now put your hands on your belly. Twist around. She's going to notice it. That's probably even better. This was her bad. How's that feel now? Oh wait, it was going the other way, wasn't it?
Yeah.
So go the other way. How's that feel?
It doesn't pull here.
Good. Excellent. Now let's go to but that's still kind of a tighter side.
Right.
All right. Go to your left now. Put your hands on your belly and twist, 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 twist. Let it be comfortable. And if any of your legs feels like it wants to move like this, you know, a lot of times this will want to happen. That's fine. You know, if something's pulling, just let it go. Okay?
The only thing is the doctor doesn't want me to go in like that.
Yeah, and that's what I'm saying, is that you can bring this leg over. So you can literally, you can literally do that. And bring it over again. There you go. No, not yet. Do it one more time. All right, and again, this leg can come all the way over to here if you want to. And so she's getting the rotation, and she's still not, quote, you know, making it too much, and it looks really good. Now, keep everything flat, feet flat back where you tested before. Put your hands on your belly, and rotate that way. How's that feel?
That's a little
good.
bit.
Now, I want you to keep your feet flat. Keep your feet flat. All right, got something on you there. Keep your feet flat and rotate to the right again. There, how's that feel?
It's tight.
All right, are you going further? And is it tight in your trunk or is it tight right there?
No, it's tight.
Tight in your mid-back, see, in her mid-back. Now, so now she's not feeling it here where it was tight before. Now she's all the way up in her upper back. That's good. All right, so one of the things that's tight on her is her upper back. Well, what if we freed up her upper back? Would it make all the rest feel better? And this is typically what you find, is it's the trunk that if it's freed up, frees up the hips, frees up the knees and stuff. All right, so go ahead and rotate now. Go ahead and to this side, to the good side, to the good side. And just think about twisting. Yep, you're allowed to move your legs, let everything feel good. Twist in your upper body. There you go. Twist in your chest and your mid-back. Good, and twist in your lower body. If this leg wants to come over, do it. If this leg wants to drop, if you want to slide your butt, whether you do it, there's no such thing as cheating. Good. All right? Do it again. No, not yet. Twist first. Take up, you know, the slack, sort of. Good. Now go ahead and jump. You do your legs slowly, one little at a time. As this twist, let that twist.
Okay, now it's pulling just a
No, that's
little
because
bit
then
here.
move your leg and keep twisting. All right? Good. Relax. Stay everything, stay put, planted, feet planted, this planted, because now we're going to test going to the right again. No, we're not treating it, so just stay and test it. There you go. How's it feel? Notice how much further she's going. Come on back. How's that feel?
It's just pulls a little across the back.
Is it less?
Yes.
All right, so stand up for me. Excellent.
I
Now,
can't believe that.
now check this out. She was on, move for a second. We're going to lower it by 3 or 4 inches and see what she feels like getting up on her left side now. Let's see, she's going right. There you go. Now pick up the right leg too as you go down. Pick it up.
Pick up.
Ta-da. Drop still, but not bad. We haven't even done anything in the lower body yet. Pretty cool, huh? Good. Just go ahead and get up normal and bend over and see how you touch your thing. There you go. Come on back up.
That doesn't pull at all.
Good. And good. All right. So go ahead and walk. No pulling in her back now. So oftentimes people stay not moving for a lot longer than they should, and what they do is they have a lot much more motion, and that's going to help them heal even better. Good. Come on back. Let's see. Let's do the leg raise. See, we're doing in reverse order here. Okay. Now, let's test both legs again. Good. Now the other one. And that one hurts her.
Yeah.
All right, so what she's going to do here is you're just going to lift this one up, and maybe she can't keep it for 20 seconds, but you'll be able to keep it for 15 or 10. Just keep on trying to lift. There you go. That's perfect. All right. 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Decent? Yep. And again, whenever you're ready. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Okay, that pulls right along there.
Okay. All right, let's go and check out what this looks like now. All right.
This pulls right there.
So she got a pull and cramp, fair enough. So she got a little bit more of an ache through here. What is this? Is this good? Is it bad? Did she get better? She lifted it higher. There we go. But let's just do this one again. But we won't hold for 15 seconds. We'll do 3 sets of 10. And if something's funky happened, we could do reps. Right? Sometimes that reps feel better to people. But right now we're just going to do holds again. But we'll do 3 sets of 10. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax. And remember, there's a rule that if both sides bug you, don't do that exercise. And I'm trying to determine if this is just a muscle, which is fine, or whether it's something or not. So we're just playing around with it a little bit here, and if a little bit I decide that's more than a muscle, we'll deal with it. But how do we know it's more than a muscle? Typically, she'll put a finger and go, ow, that hurts. Right now, she's rubbing it. It's more of a muscle-ish kind of thing. And if she says, it's not getting worse, that's cool. All right, so let's try it again. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
I didn't start pulling until the very last.
Very good. And you may say, well, hey, wait, is that pulling a bad thing? I don't know yet or not. I'm playing around with it too. It'll determine maybe what happens over here. Right now, does it feel like a pain or a pull like a muscle? What's it?
Pull.
Like a muscle or a pull like what shouldn't be there?
Like a muscle.
Okay, fair enough. And they usually answer me very truthfully, and they know. One other time. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax.
It gets like a tired feeling.
Very good. That's a nice way to, that's perfect. Kick that one up now. See how many long we got. 10, 9, 8, 7, 6, 5, 4. And relax. That's good. Because you were getting after 3 seconds before. And I only did 10 seconds just to see if she had the ability to keep it up a little bit longer. I'm not trying to treat it, just seeing what she's got. Looked pretty good, didn't it? All right, now, stand up. Good. And now what I'd like you to do, we'll do the sit to stand here in a second, but seeing you're standing up, why don't you bend over and see how you feel. Come back up, and that's far enough. You don't need it.
It pulls a little right there.
Okay, let me ask you this. Is that better or worse than the last time you bent down? No. Before you did the leg raise, is that better or worse than... You did the leg raise. Before you did the leg raise, we bent over and you felt pretty decent. Now you've done the leg raise. Did that make that feel better or worse when you bent over?
Kind of the same.
Does kind of mean a little better or a little worse?
I would say a little better, because I think I went down farther.
Okay, fair enough. See, she's pretty aware about those things. Now walk for us. So if at any time she gets more of a get up in her hip, or she bends further forward and she gives, I'm looking for honest data. As long as I'm always being aware and I'm asking those questions. What does she think? Does she go further? All right, is she just not saying it's worse and it really is? I want true data, and I want her to say if it's worse, it's worse. And then we'll say, you know what, must be leg raise just wasn't a good thing. But it was doing good. So now let's check out this. So the leg raise hasn't done massive improvements on her or anything. And go ahead and try to get up with the left leg.
Put your leg up.
All right, try it again. Well, you don't have to put it out.
I don't have to.
You can just pick it up. All right, so she can't, but that's okay. So now that she's doing it the correct way. So she may have gotten a little worse. So that leg raise just wasn't a positive. Go ahead and test from over there. So I'm not convinced exactly that the leg raise has been a wonderful thing for her. And that's positive information. Maybe something I decide not to give her for homework. Good, that's enough for now. Come on, and now let's do the...
I do it real good with my right one.
I know, and that's exactly what we're going to do now. So she started. Go ahead, keep doing it with the right one. In fact, you'll probably can come over here. Come on over here. And go ahead and treat, there you go. Is that okay, or do you think it would make you too sore? Now, you can start doing a couple here and then go over to the big chair if you want to. So she's going to try for 10 of them. And so what's nice here, there's 4 exercises. Does she have to do all 4 at the same sitting? No. But if I wasn't talking, it might take her 10, 15 minutes. How many sets should she do? I tell people always, do it until, you know, if you're going to just decide, hey, I'm just going to do the sit to stand this session, you know, do 4 to 6 of them. Do it until it stops improving.
Now, I could not...
Why don't you go to the other chair now?
I could not go this low at home when I did my sit to stand.
On the good leg even?
No, I
On the good. Okay.
couldn't.
Go over and finish them up. What'd you get, 6 or 7? Or did you get 10?
I couldn't get
No,
up.
right now. How many did you get over here?
10.
How many did you get? She did 12 or 10? She already did 12? Okay, so she already did some. And so she could finish them up. Cameraman was counting for us. And she can rest as much as she needs to. And notice when she comes up, she's coming up with her foot off the ground. But when she gets up, she touches just for balance, and then she picks her foot back up. No biggie. Now let's just say that got, you know, kind of hard. How many did you do?
5.
Well, come on.
You stop me.
No. She could actually go up on the armrest. That one might not be too stable, so I may do an armrest of a sofa. And if you know, again, these are just heights. You may say, oh, I don't have 2 chairs at home. You don't need a chair's height. You can do a bed, armrest of the sofa. Good? How many did you do?
10.
Right.
I did 5 and 5.
That's fair enough. 2 sets of 10 or 12, that's close enough. All right, we're going to let her rest for a little bit. And then we'll come back over and we'll test her. We'll test her in bending. We'll test her in walking.
So what do you want me to do now?
Let's come over here and retest going on the left hand
Can't get
side.
over how I can stand up so quick.
See? And now pick up your right leg and try to get up on your left. Did you cheat at all?
No.
All right. Look at that. No, get up on your left now. That's your good leg you were just getting up on. Now try to get up on your bad leg. Not quite there yet.
No, I don't
okay?
think so.
Go over to the right side. So she was actually cheating before. That's why she could get up.
No, I wasn't. No,
When
I
you did the
wasn't, but
twist-
now I can't seem to do it now.
All right. So maybe something's there. All right, come on over here.
All right, that's better because I'm just touching the floor with my heel, just a tiny bit.
All right, come on back over here. All right, actually, you know what? Sit there. So you may say, oh, what's going on? Well, I don't know whether she's truly doing it correctly or not. She said she was, but we could go back to the arm raise and see if it fixes her. Could she theoretically be getting really tired? Maybe, but she still improved a bunch. So stand up for me and walk. Just make sure that's doing well. You don't always get a crystal clear picture. You just have to use what you get. Come on back. And she's...
I feel like I'm walking straighter.
Feel like you're walking straighter. Excellent. And how much better do you feel walking now than when we started?
Oh, yeah.
How much?
I would say at least 90%.
Okay. And she's using 90% as better. She doesn't mean it's normal, right? Because she's 10% away from being normal. Okay, stand here and go ahead and bend over. Look at that. See the speed in which she did? Come on back up.
And I went
See the
farther.
speed and the quick on both sides. She wasn't cautious or anything. Her mind knows, or her body knows this is okay. Her mind was preventing it sometimes, and some of her body, but she's so much freer. Now what I'd like to test, she's done. Okay? But what I'd like to test, I'd like her to go back to the arm raise and see whether by doing the arm raise she's able to get up. All right? So what would I give her at home? Again, I'm giving her...
This is what gets me.
Oh, like you said, oh, how much better?
I've been having to sit on the end of a couch and use the arm to get up.
Very good. That's fast. That's good. All right, so let's go back and retest your right and your left shoulder. Put down. Do the other one. Still a little tighter?
Boy.
Well, keep it right by your... Okay, touch my hand as you come up. Good. Now touch my hand as you come up.
They're both good.
Pretty darn good. So still, let's treat this one, seeing we had called that the better one before. Up, up, up. And see, I'm not really worried too much about this. So up, 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 back, 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 up, up, up. Don't lean back. Make it be an extension of your spine if you do. So she was sort of leaning back a little bit. And that's okay if she does. If it felt okay, like you weren't leaning over too much, that's fine. You can do that. If you still feel... No. 2 sets. Up, 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 up. And so what I'm trying to determine is, hey, was she just tired from doing the exercises? Maybe. But let's see what she can get out of the arm raise. Because this helped her. And back down. Good. Retest this side, which is already pretty decent. See, that's nice motion. She's got really pretty motion in her arms. Now, see if you can, well, give it a second. And again, it may have been she just did 2 sets. And when you're ready, go ahead and try to get up on your left leg with picking up the right one. No, so we'd want to go back and test to see whether she really was putting her foot down last time. And I didn't catch it. All right, she's saying she didn't, but you know, we'll check it next time. Doesn't, you know, this isn't crystal clear, but stand up, touch your toes.
Touch my toes.
Just joking. There you go. Come on back up and walk. Look at that. It's about as good as good. She does really well with that arm raise and stuff. But I don't want her. Come on back and sit down. She's got to balance her whole body out. She's got to do all 4, but it doesn't mean all 4 at the same time. So when you're at home, I want you probably have enough time to do 2 of them. So choose 2 of them to test and treat. And you can go ahead and bend over and walk and see how you're doing, and then see how you're doing afterwards.
Exercises.
Yeah, so maybe the first time you'll do the arm raise with the twist, or arm raise and the sit to stand. And the next time you do the twist and the leg raise. If that leg raise, if anything gets you kind of funky, you just won't do that for a session or 2. Okay?
Can I try here with my...
Yeah, absolutely. And that's usually what happens. They get kind of... All right,
I just don't
sit back
have...
down.
It doesn't hurt.
Good. That's good.
It's just that it
And that's
doesn't
enough.
want to work.
It's getting there.
It's
You'll
not
get there.
hurting at
Good.
all.
All right, that's enough. Don't do it. Do 3 or 4 or 5 on the other side. I don't like people to stay treating just that side because I don't want to throw them out of balance. So I'm just going to have her do 4 or 5 of these just to, on the good side, to put her back into balance. And then over the time, you'll see how she does. And that's good to go. Fair? Hope you guys enjoyed it. You're good. You're good. You guys enjoyed it. And how much better would you say? Oh, there we go. There you go. There you go. There you go. Oh, so she had to rock. So she couldn't do it without rocking. Stop treating. Now do some more treatment on the good side. I don't ever want to leave her having done just the bad side. There you go. So it was that little more of a rock she had to do to get up. Now that's good. Sit, 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 sit. So at home, she's going to treat herself 2 to 3 times a day. Well, 3 times a day I'd like her to. And she's going to, you know, you're going to do all of them if you have time. All right, how many sets should you do? Just do them until everything gets better. If it's 4 to 6 sets, cool. Do you have to do all 4 every time because you might not have time? No. If you want to sometimes during the day, hey, I got time to do the arm raise, just do the arm raise, several, 4, 6, 8 sets, that's cool. All right, but always test something beforehand, like your walk, you're bending over a little bit, or just getting up and down from the chair. All right, just with both legs though. Cool?
Okay.
All right, what do you think?
What do I think?
Yeah.
I think it's helped.
Okay, good. All right, thanks.